Yes, good morning everybody. As we've heard this morning, good news in that the curve is flattening, but of course it's not flattened. We can see some light through the woods, but we're not out of the woods yet, so we need to remain vigilant. It is pleasing, however, that the measures that have been taken seem to be working in our region. We've effectively had a lockdown in our region and kept cases out, but we have to remain vigilant. And on that note, I want to thank, first of all, the health staff who continue to prepare and deal with cases that we do have. Thank you. It is a time of anxiety for you, and our community is grateful. I want to thank the police for the work they've done over the Easter period. But I particularly want to thank people in our community. Easter was a difficult time. Many people spent it on their own when it should have been a time with family. There were many people who had holidays disrupted, and I know a lot of people suffered through that. I want to thank them. I also want to acknowledge and thank those businesses who've suffered and people whose work has been affected, who are really struggling with the economic stress of this. I just want you to know that what you've done, the sacrifices you're making, are making a difference to our community and are saving lives. But I realise that that's tough for you. I think the government recognises that and there are measures in place, but I do want to thank you and acknowledge that. There's real pain, and certainly that's something that I hear in my office. Thank you very much for that, and thank you again for those people who had their holidays disrupted over Easter. Just a few issues to comment on. First of all, it is disappointing that ACM have chosen not to publish their daily papers. I think that for many older people in our community who do not have access to Facebook, that is a source of information, and it's something I'll be taking up with the government to see if we can support them to continue that. I do want to congratulate the government and the Murrumbidgee Local Health District on getting that accelerated pathology testing up and running. I think that's very important. We've had more testing clinics open now, and as Jill Ludford has said, it's very important if you've got symptoms of a respiratory illness, cough, fever, sore throat, any of those. It doesn't matter whether you've been overseas, doesn't matter whether you've had contact with someone with COVID. If you've got those symptoms, please get tested. There is a hotline if you're worried. It's 1-800-831-099. Please ring that if you've got any concern. The reason is that if you've got those symptoms and you turn out you do have the COVID illness, then if you deteriorate later, we can treat you properly. If we don't know you've got it, then you're putting your own life at stake. And can I also say, of course, that you would be infecting the community. So I know people are anxious about having the diagnosis, but it is important for us that we identify all the cases possible. So I encourage you to do that. And finally, of course, we know we're coming up to flu season. This year, the call is to have that flu shot early. I had mine yesterday, got through that okay. And I just encourage those who would normally get their flu shots to consider it, getting them as early as possible. I understand supplies are available. I think it's an important public health message. Once again, thank you to everybody.